number of pounds. Very, very nice, very kind, very considerate, very professional.
Very nice. I love fishing. Very professional. And you don't have to wait long or anything. They treat you like queen.
I live down around Clear Lake, and I get good quick service. You know, from what I'm paying a couple $100 for now, I used to pay a couple $1,000 for a couple of yearly checkups. See how fast they are?
Prompt service. I used to have years ago cancer, and I took the PET scans with a nuclear infusion, and it was always very good care.
I'm Diego Roldán. I'm the general manager of Assistant Years, and it has been a pleasure to work in this company and grow from 4 employees to more than 60 employees.
We do all types of ultrasounds, basically from head to toe, for 11 years, and they treat me like family.
I work for Houston Medical Imaging. This is a Siemens scanner, a 1.5 grade company. We have several facilities, one in Richmond, one in Campbell, on site.
The MRI on one patient. It's a closed magnet, 1.5
Tesla Siemens high field MRI. It is a short board. I'm an MRI tech for about 14 years. I've been here at HMI for a couple years, and I'm really happy with that. Everyone here treats you like family, and that includes the patients when they come. What else to say? It's called a high field open MRI. It's very spacious in here, a lot of room for patients. It's open all on the side over here so they can see out when they're in there doing their pictures. We're getting very high resolution, sharp images. The doctors are very happy with that. And this is some of the support equipment for the MRI, compressors and chillers. We have to keep this room very cold. They put CT/PET CT machine. The back part of the machine, state of the art. It's very fast. We can scan CTs in about a minute or under.
I'm here to introduce a Hitachi Sonaria 64-slice CT scanner. It is a very high-resolution, low-dose scanner. We can perform 3D reconstructions, cardiac scanning, CT angiography. This is by far top-of-the-notch technology. I've been doing this for about 12 years. This scanner is located off the Katy Freeway, the Campbell location.
It's used in nuclear medicine. The patient is injected with radioisotopes. It's especially good when detecting problems with the heart, the lungs. The patient will lay on the table. The camera then rotates around them.
David A. Gonzalez. I'm a cardiologist, and I've been with the care here at Houston Medical Imaging. The Houston Medical Imaging is the stress testing echocardiograms. And
hi, my name is Kim. I'm the cardiovascular technologist. This test here is actually a carotid Doppler. And for the exam, we place the transducer on the neck and we slide the transducer on the neck and we're able to locate the carotid artery. This is here, the little circle here. And we use this to check the velocities of blood flow that's going to the brain.
So patients won't have to lay down. You can do all your images upright. You're also able to do like arthrograms, PSI, diaphragm enemas. You're able to move the machine around the patient if they're laying down.
Technologies, specialties mammography. I'm working for NTMI for a couple of years and I'm so happy to working for this company. The machine we do have for mammography is innovation. Usually it starts with 4 to 5 images. It depends on the shape of the breast and size of the patient. And our control console, we control our technique.
My name is Randall Stanowin. I'm a radiologist. I've been working here at Houston Medical Imaging since 2002. I am a working guy. I read studies every day. I do biopsies. I take care of patients, but in the meantime, I'm also the CEO of Houston Medical Imaging, so I do get involved on the administrative side.
Chest, comma, portable, upright, 215. Impression number 1, there are moderate to large bilateral pleural effusions. Period. There is bilateral lower lobe consolidation. Period. Paragraph. Contact. There are no comparison studies, period.
As an example, in this particular case, this is a routine study that was ordered. It was completed at 12:10. It's currently 1:55, so less than 2 hours. The report is now, it's now been faxed to the doctor's office. It's available online.
Patient text sends the patient to CareStream, our PACS, and radiologist doesn't see the patient. It could be that that's miscommunication with the fax, the service went down,
a new patient portal which is called MyView. And MyView is a mechanism by which patients can access not only their reports but also their images. Now is accessible. It uses a code called HTML5, which is Advanced Internet Code. So it's accessible on your computer. Sometimes patients will have to install what's called a Google Frame onto their Internet Explorer. It works with Firefox. It works with Safari. So you can look at it.
Visualize portions of the upper abdomen or within normal mitochondria from Houston Medical Imaging. And on a CTA of the chest, it's a limited exam, but I don't see any large PE. Okay. Thank you. Bye-bye.
Hi, I'm Dr. Jim Kane. I'm one of the staff radiologists here at Houston Medical Imaging Service, which involves doing spinal injections primarily for people with back pain and herniations and pinched nerves in their back. I'm proud to be a part of Houston Medical Imaging, and I really do feel that it is the premier outpatient imaging center in Houston. 4 of us, and now there's 15 or 16 of us.
We are the beta test site for CareStream. So we are at this time, the only people in North America that have the MyView patient portal. It's being set for general. I think this is something that Dr. Calderon shares my passion with. Information technology is very key to providing improved healthcare.
The doctors fax over the information through a fax server, which gives us the opportunity to go ahead and get the information from the fax server and call the patients immediately and try to get them scheduled onto our scheduling.
Hi, this is, I was calling in reference to your appointment for today.
My name is Mohammed. I work in the MRI department with Houston Medical Imaging.
We strive to do at Houston Medical Imaging is to provide high quality care at a low price. And we recognize that there are a number of patients who do not have access to insurance, who may have very high deductible policies, who frankly cannot afford to pay for this high quality imaging. And so nighttime medical imaging is a mechanism that we've developed, kind of a subcommittee or subcompany, so to speak, to provide inexpensive but yet maintain the high quality of the modalities, of the radiologists, of the information system, and thus provide our patients with a value type of. So whether you are a standard Houston medical imaging patient or a nighttime medical imaging patient, you're going to be imaged with the same care, on the same equipment, and be given the same diligence when we interpret your study and transmit the information.